Apples to oranges. My wife is from northern Minnesota, and I came from Nepal. I came here when I was going to college, and we decided to get married. So once you get married, there's a lot of differences you find out about each other, right? Mm-hmm. And more along the line you are in a relationship, more you find out about each other, how different you are in some sense, how similar you are in some sense. So we have, some kind of discussion between relationship, like my siblings' relationship and her siblings' relationship. I have a younger brother. He lives in Sydney. Growing up in Nepal, even if you have a sibling, you're supposed to support them as an older brother. Financially, emotionally, and a lot of different things. You should be their support system. And it's a little different in different culture. And the burden of responsibility is so much different between people too. And it was really hard for me to explain that. The siblings relationship you have with your siblings is not the same relationship I have with my siblings. They both are siblings. So it was really hard to explain it. So then I told her, it's not apples to apples, even though they are siblings. It's apples to oranges. They're completely different. And I give her a ending with a story and why it's different. So I give a background of my family and try to make her understand what it meant. And she got it. Now she understood that siblings and siblings are not the same. Her siblings, the relationship she has with her siblings and my relationship with my siblings are not the same because they are not apples to apples, right? So anyway, so that was kind of the background between the apples to apples. So I am a guy who love metaphors. This is one of the examples. Apples to oranges is a one metaphor about different relationship, right? How many of you here know what metaphor is? Everybody, right? So it's a pretty standard talk, but I am like crazy about metaphors, if you ask me, right? And I like metaphors so much that I wrote my first book based on metaphors. And now we're trying to write a second book together, me and my wife. We're going to write stories about metaphors and storytelling. So we're going to combine it together, and we're going to come up with a book called Apples to Oranges. She's going to talk about how we communicate in the healthcare industry as a doctor or nurses to their patients, talk about this complex disease that they have. And I'm going to talk about this new innovative ideas at work that I need to explain it to my business user. How do I explain that? So it's a pretty challenging. We're trying to solve it. And I have really extensive research on metaphors, like I mentioned. I have read about more than 200 peer-reviewed articles just on metaphors. So if you ask me, I'm the expert at metaphors. That's my expertise. And she is a storyteller. She works for the Children's Hospital, and just now she wrote about 97 stories about Children's Hospital of Minnesota, and she's going to submit that stories to the board called Magnet Board. That's the highest standard you could get as a hospital. And the first thing they look at is the stories. Stories you have about the quality, stories you have about the safety, stories you have about the patient care. So it's stories about the nurses, stories about the certification, whatever stories your business have, right? So you gotta put that in stories, and the first thing they look at is what story are you making in the hospitals. So you're trying to combine all these things. But my topic is about research, so I'm just gonna present some of the research I have done around metaphors and stories. Metaphor is a word came from Greek. It's called from metaphorin. And metaphorin means connecting new concepts. In Germany in 2004, they did research on how do new innovation that happens in Germany gets communicated to people. And they did research on people who are leader at different industry, how they explain that to journalists, and how journalists write them out to the public. That's how the transformation of information happens. Yeah, metaphor is really good at communicating. Is it effective? You gotta figure it out. Is it effective? So, in Johns Hopkins Medical Institute, they did a research on medical transcripts. So these are the doctor and physician. They write out all the things happen between doctors and patients, and they analyzed that data, and they found out doctors who use metaphor to explain the complex diseases to their patients, they get higher satisfaction from the patients. So which means that they are so good at communicating what's happening to the patients. Complex disease like cancer, it's pretty complex to understand, and not just what happened to them, what they're gonna do about it. And they found out, it's very effective. And one of the example was they use a metaphor for cancer. It's usually war, sports is what they usually use. So when you fight cancer, it's you're already saying that you're taking the cancer as a war. So you got to fight it, right? So that's how you can get that concept in your brain. Not just that you're not gonna let that cancer die you down anymore because it's a war, right? So anyway, so that's how the doctors were able to explain it to their patients. And it's good. It's the same in our personal life too. How you think about arguments. If you think of argument as a war, somebody has to win. But if you think of argument as a performance, then you present an argument. You don't demolish other people's argument. So you just, when your wife wants to argue with you, just think like it's a performance. It's not a war. Nobody has to win there, right? So that's kind of what happens. And yeah, I'm pretty excited about this whole journey, and I'm excited to bring it out here for you people to see how how the book turns out, and what we could do it for the communication in IT and healthcare industry. Mr. Toastmaster.